So the presentation does not include any other entity that I may be affiliated with, both professionally and personally. Thank you all so much for having me. We have about an hour together today. I understand that it's a large crowd, a large gathering. So I'm going to ask you all to grab a piece of paper or throw your questions into the meeting chat as we run through. I have a very brief PowerPoint slide, about 10 slides. However, they are a bunch of powerful points intended for us as behavioral health providers to kind of examine our own self-care in the middle of this pandemic. So I am going to share my slides. Uh-oh, it was supposed to go from the beginning. Let me move back. Sorry, guys. So our time together today, we have a few objectives, lesson agenda. A few objectives is that we're going to be able to identify some of the challenges associated with our service delivery in the middle of a pandemic. We're going to look at various self-care strategies with a full dialogue and discussion of the heightened relevance of why self-care is needed now. And then at the end, there is a piece for strategically for leadership, helping leaders to develop skill and insight of strategies for building resilience and support for their team in the middle of this trying time of pandemic. I do have a dialogue slide here that I'm going to show, but it will kind of be our discussion at the end where we have time to really have some brief dialogue. I am interested in hearing from you all with what impact has this pandemic time had on your physical self, your mental and emotional self, and notice I've split those intentionally. Want to have a little dialogue about your professional self, and then any other areas where you may be able to say honestly and transparently that I feel the impact of what has changed in my life. It's kind of the space that we want to talk about today. Looking at the adjustment that's required for this change in our lives, it was just suddenly, all right? When we got the word about COVID-19, it was kind of like shooting from the hip. Everybody need to move and adjustments need to happen, and they need to happen rapidly. So I captured a few places where I experienced change and some of the things that I thought that were essential for behavioral health providers and a behavioral health team to look at in terms of where our changes took place. Service delivery, of course, I'm sorry, did I hear, yes, can you all hear me? Service delivery changed rapidly. We moved from direct face-to-face contact to virtual, telephonic, kind of threw us out of our element for what we were used to in terms of our care and the delivery of our care and how we take care of our beneficiaries or patients or constituents or whatever name you give the people that you treat. Family life, again, kids are out of school, everybody's quarantined, we're a little too close for comfort with the people we love, like, and know in terms of our physical space change. Social life, we've been called to social distance. That again creates a huge barrier for adjustment when we are accustomed to coming and going as we please. Work-life balance, I incorporated thinking about, and I want you all to think about honestly and authentically through these adjustment domains that we're talking about. How has my life changed in regards to my work-life balance? Am I working from home? Am I trying to parent and educate my children at the same time? Have I suddenly moved from being a therapist, a counselor, a provider to a school teacher, a librarian, a gym teacher? Like, what has happened to your work-life balance? And then that final piece is mental readiness, right? How do we feel mentally? When we think about trying to adjust to all of these changes, what happens to me on a mental readiness aspect? Do I honestly and authentically believe that I am ready to do my duties? Has there been a decline in my readiness to provide a service or my availability to those that I treat? And I want to add, before I move to the next slide, I know we're being recorded, but I want this to be a safe space where we can be honest, where we can examine ourselves and really do the work to be able to adjust in our current living situation. So that is adjustment domains. We want to be strategic today to talk about self-care strategies. I want you all to think about, what have I done for myself in trying to adjust to all of those domains that I just rapidly ran through. And I know that I'm moving quickly, but I'm not a presenter that read directly from the slides, and I'm probably out of my comfort zone because I am an in-person presenter, a very interactive dialogue, less exchange. So not being able to reach out, touch you all with a whiteboard and talk in a room with you is completely out of my element. So if I'm moving too fast, please just jot your questions down. And when we get to the end of our slides, I'll be happy to have some dialogue or some explanation of what I'm talking about. Self-care, what does that mean? What does that look like? Most of the time, we are pouring from a pitcher and not necessarily drinking from a cup. What do I mean by that? We're usually, if I'm speaking to a room of behavioral health service providers, we are most comfortable taking care of others. I want to encourage you or question you or admonish you to begin to look at how you're doing in this season with your own self-care. So this slide covers some ideas or some techniques, very simple techniques, but they're practical and simple, but easily overlooked. So I want you all to think about these self-care strategies and which ones can I apply to my routines so that I am ensuring that I'm giving myself some quality breaks and quality rest. So the first thing that I put on the slide was the use of mobile applications. I don't know if anyone in here has ever used them for themselves, but a few that I happen to like is Breathe to Relax and Cope. Calm, I've used Calm, but I like Breathe to Relax. It offers a strategic walkthrough of teaching you how to slow down, use some breathing exercises to just calm your space. Virtual support networks. How often am I connecting with people, right? We've been encouraged and, well, mandated, not encouraged. We've been mandated to socially distance. That does not mean that we should not connect and still meet socially. So how are you virtually connecting? And even in your networks with the people that you are connecting with, how wholesome are these networks, right? When I'm thinking about self-care strategies, now is probably not the time for me to be connecting with people that are drama-filled or draining my energy. So it's still important that we communicate, have Zooms, have virtual. I've seen people doing virtual happy hours. I participated in a few virtual learns, virtual let's chat, just maintaining good quality support networks. And in these networks, ensuring that we are honest and transparent with where we are today. All right, if I had to talk about where I am today, I'm tired. All right, the rain, the work, everything that I had to do just seemed overwhelming. So being able to rely on virtual support networks has been immensely beneficial in self-care strategies. In your networking and talking to people, probably encouraging you to get out of your comfort zones. Stay honest about your strengths and limitations. If you're struggling, say that. If you can't meet the deadline, say that. I think it's really important right now, if we're thinking about self-care strategies, that we accept that this is not our norm. So my optimal performance may be different. And I think about in different settings where I work, we talk about adjusting our fire to still accommodate the mission. And that does not mean that we change the mission. It means that we examine what our strengths and our limitations are and adjust fire accordingly to still meet the mission. And I'll talk a little bit about that again in the leadership slide and the leadership role with changing our expectations. And that may mean deadlines, due dates, due outs, and things of that nature if we're going to manage self-care appropriately. Stay in touch with your own mental health needs. Take breaks when you need to. Rest when you need to. Take a day off when you need to. All right. If you are a person that like to accumulate time and use or lose is your friend, not mine, but use or lose may not be your method of operations right now. Take a little time to take care of your own mental health needs. Ask for help when needed. I talk about that a lot. Stay authentic in your exchange of where you are. Simply just talking things through may help you breathe differently and feel differently. Then the element of physical movement. stretch, exercise as best as possible. I've been encouraging people that I speak with during this time to not miss out on your routines as best as possible. Download some videos, some apps, or something where you can still get some exercise in and some self-care where movement is a part of your routine. Nutrition and sleep, I kind of tie those together. What we put in our bodies tend to project how we feel and what comes out. So it's really important that we're eating good, wholesome, quality meals, reducing our sugar intake and alcohol intake and all of those things that would drain nutrients from our body. And then finally, sleep. Please, 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 I can't stress sleep enough. Get some good quality sleep, practice some good sleep hygiene strategies. There's a lot of literature and research to talk about the correlation between how we think and how rested our brains are. So I would encourage you all to be certain that all of these domains of balance are kind of incorporated in your day-to-day routines. I kind of divided, I found this slide. I kind of divided the self-care up to kind of break out domains for physical, emotional, social, and spiritual. Much of what I talked about in the last slide falls into these domains. For the physical piece, you want to keep movement and activity as a part of your day-to-day routine. All right, we suddenly went from people that move, shake, and go to people that are seated and still working. So it's really important that sleep, stretching, walking, physical release, whether that's dance, jumping, singing, whatever your physical activity is, to include healthy food and rest under the physical domains. With emotional, I talked a lot about managing our stressors. This is the time to pick and choose in personal spaces what is going to be priority in our lives, right? When we're thinking about managing our own stress, it may be important to split the plate now and really look at what needs to be here and what can get put on a timeline for later. Thinking about our own emotional maturity, how we speak to ourselves, what we say to ourselves, just that whole positive self-imagery. Being able to forgive and let go of grudges. God, I can't tell you the emotional impact for self-care that has. And then operating and moving in spaces of compassion and kindness, right? We're not the only ones going through. Our patients are going through, and this is a season where there's shared trauma. So it's important that we're able to have our own safe spaces that we're talking about what we're living through and what we're living with during these rapid changing times. And then for the social domains, I talked again about this: boundaries, support systems, positive support systems. Do you have a safe place to cry? Do you have a safe place to scream? Do you have a safe place to just yell? Whatever it is that you need to do you have a safe place that would be supportive, encouraging, empowering, and building you up for a resilient readiness? With our spiritual domain, time alone, meditation, prayer, yoga, journaling, sacred spaces. Probably very difficult if you live in a house with a gang of people, but finding a time and a space where you have some quiet time alone to just reflect, meditate, and regroup. I can't emphasize enough the benefits and the necessity of this time for our own interventions for ourselves. I am a theoretical person. I'm a theory grounded based person. So when I thought about this and I was putting this together in terms of speaking to a group of behavioral health practitioners about how to turn our eyes inward and take care of ourselves, I began to think about the grief that's associated with all the changes that we're living through. And in that grief, I started thinking about moving from a hierarchy, from grief to gratitude. How do we move from the grief space to a gratitude space and ground ourselves in a survival mission for what we're living through? And of course, one of my favorite theorists came to mind, and I pulled from my good friend Abraham Maslow. And I wanted you all to think about if we start at the very bottom of a hierarchical structure, thinking about what we need to change our mindsets from being overwhelmed, overburdened, tired, fatigued, and just a lot of negative self-ideation, I wanted you all to think about Maslow. If I start at the bottom of this, and I'm using this as a framework for your own self-care, to leave today with a framework for how I'm going to take care of me. Not only am I going to exercise those self things that were back in the other slide, but I'm going to put a theoretical base with this and begin to examine my self-talk, how I feel and how I believe, and where I can move to a higher level of survival. So with Maslow, we know he has his model and his theory looks at intrinsic behavioral motivation for human behavior and change. What I'm asking you to do is start at the very bottom with some very basic questions. Are my physiological needs met? Right? When we start getting into, I'm so overwhelmed, I am tired, I can't do this. I want you to replace those thoughts with, do I have somewhere to sleep? Do I have clothing? Do I have a job? Do I have what I need? And then move up. I'm not going to, for the sake of time, I want to maintain some time for questions, answers, and dialogue. But I want you all to use the self-actualization hierarchy of needs to ground yourselves in the movement from grief to gratitude. If anyone, when we get to the end and we start talking about impact, I want you to think about impact from a psychological perspective as well as a physiological perspective. Have I felt sad? Have I felt overwhelmed? Have I felt that I don't have what I need, whether it's for me or whether it's for the people that I serve? How can Maslow's hierarchy of needs help me ground myself in moving to a greater level of self-esteem, a greater level of believing that I belong and I'm a part of a system where I'm needed and I'm connected and there's some friendship and intimacy for me, even in COVID-19. How am I living my best life and providing for myself first and then those that I have to service? And we can talk about that more in the questions, but I kind of want that reference to be your frame and your balance for how to take care of myself in the middle of a time that I may have never lived through. I found this slide. I thought it was hilarious because it spoke directly to where I was essentially one day as an essential provider in many of my hats that I wear. This has been my lived experience. I don't want to be essential anymore. I am tired. So if that is your truth, I want you to reflect back to the self-care slides and think about how can I change the now of my experience where I'm not burnt, I'm not crying, I'm not overwhelmed. We know as service providers, when we are tired and we're overwhelmed, it's difficult to be an essential provider providing an essential service. So I want you all to examine your lived experiences through this time and think about how can I slow down a little bit just to take care of me a little differently. The last portion of this presentation speaks directly to leadership in any capacity of leadership, be it the supervisor on the job, the parent at home, the coach, wherever you exercise supervisory leadership authority in your life. I want you all to think about how am I leading? All right, if I am not grounded and able to lead from the front, what am I producing? What am I contributing to my team? When I talk about leading from the front, that means having a level of awareness of what kind of energy I bring. What kind of energy am I putting out? What kind of, am I approachable? Do my people trust me? Am I leading from an emotional, overwhelmed space myself? And if I am I capable of authentically saying that to my people? I'm not doing well today. I need a break, and being able to take that break. Build on people's strengths. Everybody's having a really hard time right now. I think it's really important that leadership be able to say, you know, hey, I see your efforts. I see what you're doing, and I am proud of you. In leadership capacities, be able to support your team. And I don't know what the rules of your agency are. If we can have a potluck, if we can have everybody bring a meal, but being able to build on strengths and work together to foster resilience. I think it's important that we realize that everyone's tired. Everybody's having different emotions around this. So as a leader, we have to do our due diligence to be able to foster resilience in the teams that we lead. Except that we are not operating under normal operating procedures, I think we can probably safely call our current pandemic a code red and perhaps change some of our expectations, meaning we want to prioritize what's important. We want to prioritize what's important. If we've always had a deadline that everybody needs to get their reports in by the 15th, can we be flexible in changing due dates and due outs and deadlines? Now, for the employee that's on the line, that flexibility does not minimize standards and requirements for delivery and performance. I'm only encouraging the leadership to be supportive and understanding with a level of flexibility for the teams that you lead. Really important that leaders award and acknowledge effort. Again, awarding the time may not be immediate reward. It may be at the end of COVID. I remember that every day you logged in on time. I remember every day you were a part of the team and you were positive and you had energy that was supporting our mission. So I think it's really important that leadership stay on top of being able to clap when a clap is needed and award and acknowledge that this is a different time for us, but I'm proud of your efforts. Normalize emotions. We may be shorter temperament, lower frustration tolerance, flat out tired. I think it's important across the spectrum that leaders understand that who they were working with in January may not be who they're working with on April the 30th. Right? A lot has happened between January and April to change the way that our frame of our movement works. So if you see your employees different and moving different, acknowledge that, but be ready and able to normalize emotions. Offer resources and support. Know your resources that are available to your team, whether that's the employee assistance program, individual supportive supervision, whatever it is that your agency has that's available for a resource for people in times of distress, be available to provide that support. And then the final note for the leadership is just be available to listen. Right? Sometimes people are struggling, and right now everything is all encompassed in one space. We still have people that are pouring and pulling from us that we're pouring into. I think it's important that supervision creates safe spaces. You'll hear me say that a lot because I value and honor safe spaces. I think people need spaces to be authentic and grow, but they can't do that if there's a paralyzing, demoralizing leadership arm. So I think it's really important that leaders are available with a full comprehensive understanding that this is all inclusive and having a very different impact on everybody in different ways. So each person that you supervise or have some level of authoritative relationship over will need you in a different capacity. And then my final, we're about 30 minutes out, so that still gives us some time for discussion. My final notification to you all, it says dear therapist, but I'm speaking to the counselor, the peer recovery specialist, the social worker, the licensed professional counselor, whoever is on the line, the teacher, the supervisor, whoever's on the line. I think it's really important that we be kind to ourselves, acknowledge that this is a challenging time for us all. None of us have the answers. We don't know when it's going to end, and we don't know how to exist during a pandemic. So you're holding a lot for everyone. Find a space for yourself. Remember the self-care strategies for those that are struggling, who are anxious, who are fearful, who are working outside of their comfort zone. The ad says, I see you. Dr. Phillips sees you. And I probably share the same energy with you. And I think it's really important that we stay authentic, honest, and supportive of one another. All right, so that is the end of my slideshow. Can everybody see me? So I kind of want to open it up because we're only about 35 minutes in. I kind of want to open it up to have some dialogue, to go back to that second slide where I asked about the impact of COVID to you all on so many different dimensions. Were there any? Woo, Yes.
I'm sorry, Dr. Phillips, this is Bonnie Campbell again from BHSB. If you want, you can ask people to either type their questions in the chat box, or you can ask them to unmute themselves. They could even put their camera on if you'd like to take verbal comments and questions. I'll leave that up to you.
All right, I see some chat questions, I think. I'm running through. Give me a second, guys. I am totally in an adjustment mode trying to understand this. So I see some questions, I think. Somebody's going to watch more movies on Netflix. Virtual happy hours. Anyone else sleep is off? There's a question about sleep. I have not been getting good sleep even though I am home all day and I'm not doing much activity. So there's some dialogue here about sleep. I think if I had to answer that in a question format, I would encourage you all to try your best to act as if you're still working and living through your routines in terms of setting good sleep schedules. We're all off. And if we can make ourselves or force ourselves to a time where it's time for bed. And when it's time for bed, that means cut the TV off, cut the phone off, silence things so that our brain then catches up and help us understand that it's time to rest. I had some judgment about using sleep aids and decided to let that go before I frayed for good. Jennifer, thanks for your transparency. I think it's important right now, and I stated this through the slides, that we're not so critical of ourselves. This is not a normal time, and we will not get through it doing normal routine things. So if you need the sleep aids, rest, my friend, rest. How have you navigated working from home while trying to give family members the space to live their lives as normally as they are used to? And so we talk about that work-life balance. Thankfully, I have not hurt anybody in my household, but I think the answer to that is just still finding space and being transparent with the people in the household, that we're spending more time together than we normally do. And if we need to make some rules about space and timeouts, right, we need to take those as frequently as we need to. And even if the room is the bathroom, the basement, the shower, all right, wherever I need to go to find a little bit of quiet time for me and make a space where the people that live with me, they respect my need and I respect their need if we're going to navigate how we can get through this together. I hope that answered your question, Gary. I feel lucky to be able to go to work every day because I've learned I am not a good homeschool teacher at all. Thanks for sharing, Rachel. I think, again, when we talk about that work-life balance, we're learning a lot about our strengths and our limitations, and I'm asking everybody to own that. Hopefully, Rachel, the kids have somebody that's teaching them, having a hard time working from home and ending on time to take care of myself and my family. Balance, all right? I talked about that in that initial slide. Being able to focus on how do I balance my work and my life. And that really is going to require us to be able to set some good boundaries. If my work hours are from 7 to 2 or 7 to 3 or whatever my work hours are, when work is over, the computer goes off, the phone goes off, and I'm just not available right now to do any more time for work. All right, so, and again, Star, thank you, Star. Being able to speak with your supervisor, because I'm not sure if we're working routine duty hours, right? If we have children in the house that have class at 10 o'clock, is my supervisor flexible with me logging off from work at 10 a.m. to help children with their work and then finishing my duty day at the end of the day? So again, that's going to require some leadership flexibility and a good self-paced balance for what I can do and what I cannot do. It is so much pressure to be productive. What advice do you have? That's Dr. Boone. Thank you, Dr. Boone. I think the question is, how do we define productivity? Right? If we need to define productivity, are we thinking about productivity based on who we were in December and January? Or do we look at productivity of who I am today living through a pandemic? All right. We've added an added barrier to our lives, working from home, not understanding what's happening in the COVID, in the disease, watching the news, watching the numbers go up every day. So the things that pushed our productivity in December or January or February, even now we have a draining entity that's taking some of our focus away. So I think it's important to be kind to yourself and perhaps lower the own expectations of what productive looks like. I hope I answered your question, Dr. Boone. Mr. Levy, working from home is challenging. I find it useful to try and maintain a structure. It is different than my usual schedule, but it helps me to know what I need to do and when. It is also difficult sharing computer resources with a third grader. Indeed, absolutely. We talk about that in terms of setting structure and setting routines. I think Mr. Levy answered a lot and spoke a lot to what Dr. Boone was asking about being able to set balance and structure. I think we need to be real strategic in creating timelines for ourselves and our daily do-outs. I think I went through all of the meeting chats. Are there any additional questions that someone may want to come on camera and ask or type into the chat? I want to open the room. Sleep is important. I don't stay asleep at night anymore. Thank you, Miss Artist. Again, really important to pay attention. We are usually, I think I'm speaking to treatment providers in the room, and it's probably not an easy place for us to admit and say when we need help. All right. I think it's important that we do our own readiness assessment. And if we need help, professional help, I don't think that the time now is for us to be shy about opening up and speaking that out loud. There is there's a different stress level associated with how we're moving, how we're working now. So if our sleep is changing and our energy levels are changing, it's really important that we adjust fire to accomplish our mission. I'm getting some feedback. Anybody else with additional questions?
And this is Bonnie again. I just want to remind people that they can unmute their speaker and talk out loud to discuss or ask questions. And that speaker is in the toolbar that pops up in the middle of your screen. Thank you.
Has anybody, I think I asked the question in the first slide, when you start thinking about the impact of what has changed. I heard a lot about sleep. I heard a lot about balance. Does anybody have any other impact statements or things that have happened to them in terms of their functioning and survival based on now?
Yeah, when you have to be the person that takes care of the family and you are going through the pandemic with them, they don't understand that you need a break or that you can't fix that right now.
So yeah, I see a lot of stuff. So we're talking about trying to get our family to understand that I too am going through, when normally I'm the emotional grounder.
So I came on late. My name is Kathy Towns, and I'm a substance abuse counselor for young people.
Okay.
So it's just my husband and I at home. So I guess I'm kind of like everybody else. We never thought that anything like this would happen in our lifetime. And so for me, what kind of keeps me calm is it sounds crazy. I just walk more.
Okay.
I exercise more. I walk more. I don't sleep a lot. So I pray more. I have two sisters that we correspond over the phone together. So that's kind of keeps me going.
Okay. So you spoke about the physical elements that I talked about, the spiritual elements, and then the social elements. So I think it's really important. Thank you so much for sharing, Miss Kathy. I think it's really important that we pull from every resource that we have. I hear someone in here talking about emotional eating. Eating habits have been off. I'm starting to rely on a lot of sugar. Any suggestions from you, Dr. Phillips, or from anyone else? Again, I think boredom and lack of movement and lack of routine kind of takes us to maladaptive behaviors. It's really important that we try to develop a routine and stay consistent with our self-care and what our own goals are. All right. I don't want us to come out of this pandemic heavier than we intended to be or less stress resilient than we need to be. Mr. Buck Zeller, I go to the office once weekly and try to do most of my telephonic counseling sessions there. I find it beneficial to interact with my peers so I don't begin to feel totally isolated. Routine is still important in this trying time. If we don't have the balance, it is difficult to help our patients find balance. Critical, Mr. Zeller. You are speaking to this webinar today is talking about our self-care. We have another one coming up talking about the ethics of professional practice, and that kind of speaks into that, right? Mr. Zeller brought up a really good point about us finding balance, and I think I used the analogy earlier in my discussion about us being pitchers, right? As behavioral health providers and service providers, we pour into people and we serve. So it's really important that we are still balanced so that we're not transitioning that energy or our anxieties or our lack of routine into those that we provide for. Are there any supervisors or leaders in the room? I want to hear from leadership. If leadership is in the room, I want to know how have you been able to help the people that you lead through while we're living through COVID.
Hey, Tanya.
Hi.
This is Rhonda.
Hi, Rhonda.
How are you doing?
I'm behaving myself.
Are you sure? I found myself living through this, pouring more from my spiritual church family, my pastor, and everybody. This is what's getting me through COVID.
So,
and you know yourself what I've been through.
The elements that we talked about, again, the spiritual, physical. I see somebody in here typing a lot of check-ins with staff, flexible schedules. Oh, hi, Terry. Flexible schedules and kindness. Again, excellent leadership. Being able, somebody said I've been accessible as possible, email, phone, text, etc. Letting my staff know I have an open door policy. Thank you. Jan is here. It's very challenging, feeling disconnected. I try to be mindful that everyone's challenges are different, keeping compassion up front. Thank you so much again, Jan. Leading from the front. We realize that this is difficult. I've even asked some teams that I work with in small teams to try to hold your Zoom meetings or your work meetings, try to move those a little bit to include social fun things. Even if you're building an icebreaker in your team meeting, prioritizing flexibility, team and individual check-ins while maintaining boundaries. Really important. Thank you so much, Ms. Winston Watson. Maintaining boundaries, really respectful and important. But right now they might be a little looser than they normally are because I think it's important that we stay real and flexible and able to meet the needs of the people that we lead. Amy really just put up a really good point. Thank you. reminding people that working from home doesn't mean they can't take a day off. I love it. I love it. Still being able to use your leave when you need to. I talked about in there looking at your mental readiness. We have a code of ethics that still holds us accountable for when we serve, we can't do it impaired. So it's really important that Amy brought that up, that take time off when you need it. Right now, please don't be the person that's interested in accumulating your leave and coming up at December and getting your buyouts and excited that you have use or leave, use or lose. If you need to take time off, please take it. Please take it. Somebody said, Miss Georgina, I constantly check in with my staff to thank them for continue to provide service to our clients, as well as ensure that they are doing well personally, emotionally, and spiritually, etc. Thank you, Miss Georgina. Again, appreciating your staff, appreciating your team. Miss Reed said I needed to hear that. Thank you, Melissa Jenkins. I join each group supervision periodically for Q&A sessions and send regular emails recognizing. So God, you guys are rocking. I love it. I love it. This is what is needed when we think about what we do, right? The work that we do within itself is challenging. It is immensely important that during a pandemic, we're grounded and we're grounded in interpersonal spaces where we're taking care of one another. For the people that are not leadership, I want to hear from you all. What is it that you need during this time from your leadership? What would you say you need from your leadership?
Understanding that we are not superwoman or super people. That we can't do it all, although we home, that we cannot do it all.
So a little bit of when you say that, here's what I think I hear, but I want to make sure that I'm hearing it correctly. Understanding that some grace possibly needs to be extended with due dates, deadlines, and responsibilities.
Exactly.
Okay. All right. Anybody else? I want you all to think about the frame of reference that was provided for Maslow hierarchy of needs. It's easy when we're stressed. My supervisor could remember the new productivity. Paula, I think that means that the new norm has changed in terms of what we're doing in service delivery and time frames. I concur. I think it's really important, and I gave the framework. I used Maslow as the framework for self-care in terms of a framework for grounding yourselves. In the middle of a pandemic, when we come out of this pandemic, we're going to be in higher demand than we already are. We know. We know. So I think it's really important and immensely critical right now. When I talked about the very beginning of this webinar, I wanted to look at the reason for self-care. All right, we are still in the very early phases of what the fallout of all of this will be in terms of service delivery for the populations that we serve. We serve critical high-risk populations with very poor adaptive coping skills. So we know that when folks can get back out, we don't know what's coming back out. So it's really important that the behavioral health team has sharpened ourselves with a ready, resilient mindset to not only pour into the people that we have to take care of, but to be able to have safe spaces for ourselves and supervision circles or therapeutic circles for ourselves where we can honestly, authentically scream, yell, cry, and regroup when we need to. Too many meetings and long meetings. Yeah. Think really important that we are succinct and to the point in our meetings, and recognizing that some meetings can be emails or memos, not necessarily a meetup. Miss Artist says that her supervisor has been awesome. She created a care package for us with little things that she noticed we liked along the note of support, and offers flexibility in letting us talk as needed. I love it. Thank you. Awesome. Awesome. Any additional questions? We got about 10 minutes probably. Woo. Here's a suggestion. Consider a 4-day work week instead of 5 days to build in a self-care day. I like it. If my leaders are on and quiet and paying attention, here's an opportunity to listen to your people. I like it. I think flexibility and being able to express our needs and take our time for ourselves, and even if the agency is not willing to do that, if you have leave, incorporate a self-care day and time for yourself. If you are a person that, if the regulation says you have 72 hours to get your notes in, but you've been a person that prides yourself on getting your notes all in by the end of day, I think goes back to Dr. Boone's question about productivity. You might want to change and relax your own standard a little bit to get them in by 48 hours, maybe not 24. But being able to not stress yourself, take some things off of your plate and exercise those good self-care habits and take a minute to breathe. And I did not include this. I didn't include this in the slide, but I think it is so relevant that we limit the amount of news that we take in and news outlets and reports and stories, that we limit that because the more we take in, the more it impairs our ability to focus, concentrate, think, sleep, and rest. So I think it's essentially critical that everything has a purpose, a balance, and that we're balancing ourselves decently between work, play, rest, fun, laughter, that we're balancing ourselves because if not, we'll burn out. We'll burn out. Additional questions, thoughts, or concerns? And this was very practical, very intended to be immensely practical, but to build a safe space for us to just talk about how we're doing or not doing. This has been really helpful, much appreciated. Thank you for joining us, Miss Amy, on this rainy day. I don't want to be a burden of a webinar, but I wanted to be able to jump in here and at least provide some practical skills and tips for us to breathe differently and survive amid COVID-19. Miss Bonnie, any questions?
I don't have any questions at this time, but I appreciate your presentation today. I really liked the frame of reference you've given us, and I hope everyone, it looks like there's a lot of positive feedback. So I'm hoping everyone got something from the workshop, and I encourage everyone to try to, and myself, to try to actually do some of the things, many things you suggested. So I think we can end the webinar when you're ready. Okay. And I thank you so much for doing this for the group.
For your time. Thank you so much for considering me. Everybody take the information and do your best to apply it or share it. All right, because again, we have no idea when this is going to end. We can tell our that I'm going to, and I'm going to take care of me through this. Thank you all for your time. Everybody have a good day and be safe.
You too. Thank you, Tanya.
Thank you.
Thank you. So how do we dismiss?